Health technology, the internet, GPS in the palm of your hand, autonomous operation.
Technology is a driver of our times. Since its founding in 1958 in the midst of the Cold War, DARPA, the Defense Advanced Research Projects Agency, has been a driver of technology. Welcome to Voices from DARPA, a window onto DARPA's core of program managers. Their job? To redefine what is possible. My name is Ivan Amato, and I'm your DARPA host. Today, I'm pleased to be talking with Dr. Seth Cohen, a program manager since 2019 in the agency's Biological Technologies Office. He brings to DARPA interests and experience that ranges from novel materials that can make technologies more capable, new approaches to therapeutics and medical countermeasures, and new strategies for acquiring scarce materials like rare earth elements, which have roles in many high technologies, and even potable water. We are recording our conversation from our respective homes as we do our parts to slow the spread of COVID-19. Because we are not in a recording studio, you might hear ambient sounds like traffic and planes. Now let me tell you a little bit more about Seth. He joins DARPA from the University of California, San Diego, where he is a professor in the Department of Chemistry and Biochemistry and a former department chair. His research has focused on the interface of bioinorganic and medicinal chemistry and advanced materials, including metal organic frameworks, or MOFs, which have many applications, among them sensors, chemical separations, and catalysts. No stranger to federal science and technology roles, Seth was the AAAS Roger Revelle Fellow in Global Stewardship in the White House Office of Science and Technology Policy, known for short as OSTP, and he is an alumnus of the DARPA-sponsored Defense Science Study Group. Seth received a pair of bachelor's degrees from Stanford University, one in chemistry and one in political science, and a PhD in chemistry from the University of California, Berkeley, which he followed with a postdoctoral fellow position in biochemistry at the Massachusetts Institute of Technology. Seth Cohen, thanks for joining me in this conversation.
That's my pleasure. Glad to be here.
So I always like to get a sense of the origin of a scientist's specific interests, in your case in chemistry, and as we mentioned in something as specific as metal organic frameworks. And you're also interested in sort of all that chemistry that's going on inside of cells. Makes me wonder, certainly on the chemistry side, if you were lighting things on fire in your parents' basement, or you had some love at first sight when you saw the periodic table of chemical elements. But you tell me, where did your interests come from?
My interest in science definitely started in childhood. My father, before he became an office telemarketer, was a biology teacher for middle and high school. And he was always really passionate about science. And we spent many an evening together watching Nova or National Geographic, or even, I can't remember, the Mutual of Omaha show. I think it was called...
Wild Kingdom. Yes, I remember that.
Wild Kingdom. Thank you. Yeah. So shows like this were a staple of our evening TV. Things like Cosmos as well, of course. And he always just encouraged my interest in science. We would go fossil hunting off of Mulholland Boulevard in Southern California. Always just was at the top of the list. And really, I have to credit my dad. Although he didn't go into a long-term career in science himself, he had a real passion for it and always really inspired my interest in it. And so even though I did have peripheral interest, especially going into high school, I was very involved in speech and debate and student government and had an interest in law and civics. That core interest in science, I couldn't shake it. And it just stuck with me all the way through my current career.
So fantastic parental influence in sparking that interest in science in general. But how about chemistry? What is it that directed you there?
Yeah, chemistry was, I sort of fell into it, which is probably not a super uncommon story, I would think. I went to college, knowing I was probably interested in science as a major, maybe pre-medical. I wasn't entirely sure. I never really thought about being a chemist or majoring in chemistry. I was much more interested in the sort of extremes on either side of chemistry, which was either was very interested in biology, probably again influenced by the TV shows I watched. I was interested in maybe like being a field biologist, studying animals like in Wild Kingdom, or the other extreme of being an astrophysicist inspired by shows like Cosmos. I was always really fascinated with space and astronomy and had a real love for that. But I sort of fell into chemistry probably for two reasons. One is I don't think my math skills were ever strong enough to be an astrophysicist. And as much as I loved it, it was very challenging. But probably the bigger influence was actually just a friend in college. So when I was at Stanford as an undergrad, I was in an all-freshman dorm. So there were about 100 of us in the one dormitory, all freshmen, and started making friends right away. And one of my closest friends, if not my closest friend in college, was a guy named Stephen Miller. And we became fast friends very early on. And he had a real passion for chemistry. And we took those freshman chemistry classes together and were very competitive, always trying to beat each other on the next midterm or final. And he sort of kept nudging me towards chemistry. And I was good at it at the time, at least. I did okay in those classes. And so it was, I think, a combination of having some sort of feeling of affinity for it, but a lot of just urging by this buddy of mine to say, hey, let's do chemistry together. And it's really cool. And you should stick with chemistry. And that's sort of how it ended out. And the funny thing now is Steve is also a professor of chemistry at University of Florida, Gainesville. And in our PhD theses, I credited him for my interest in sticking with chemistry. And he conversely credited me, which I thought was ironic because I never thought I pushed him into chemistry. I always thought it was the other way around. But apparently we sort of self-coaxed each other into the field.
Love that story. I mean, just how two friends would influence each other. And also the chemistry degree is near and dear to my heart because that was my undergraduate degree as well, chemistry.
Oh, that's great.
Yeah. And, for what I do as a science communicator, I felt like what that did for me is it gave me the language of science, but in a way where I could actually also talk to biologists and go in the other direction and talk to sort of atomic physicists, anybody dealing with atoms and molecules. So I think it's a great degree.
Yeah, I strongly agree with that. And although, again, I never envisioned myself being a chemist. As my career developed, I definitely found it to be a really good fit. I'm a synthetic chemist by training, so making new molecules, although I did have a postdoc in biochemistry. But that process of discovery and being creative and coming up with new molecules that nobody's ever made before, and being in the lab and making something that no one, at least on this planet, has ever made before, and characterizing it and figuring out what it is and what it does. There's this very strong element of creativity there that I'm not sure everybody appreciates. That I have found has kept my passion in science over the years. I love to make new molecules that I think people will be excited about and think are interesting.
Indeed. So I hope some young people are listening to this and hearing about the excitement of discovery that comes with going into chemistry. So maybe you'll actually influence them and they'll reference you in their PhD theses. So I want to move on. Prior to coming to DARPA and taking on the role as program manager in Biological Technologies Office, that was in 2019, you had spent about 20 years at the University of California, San Diego, in an academic setting. So I'm just wondering what inspired the leap to DARPA and how did it come about?
I think, as you mentioned, I've always had, or with my college degrees, I've always had a longstanding interest in policy and civics. This goes back to high school as well, where I was involved in a lot of clubs, particularly the Junior Statesmen of America, which was a very big civics club and sort of student government club that I really loved and still support. And so when I got tenure at UC San Diego around 2006, 2007, I had time for a sabbatical, and it was time for me to sort of scratch that itch in terms of policy interest and civics interest. And so I applied and received that AAAS fellowship that you mentioned and went to work at OSTP for a year. It was actually under both the Bush and Obama administration, so I was there during transition. It was a wonderful experience. I absolutely loved it. It was just a totally different world, and it was one of the great benefits of being a professor, an academic, was that you have these opportunities to literally step out of your everyday job and step into an entirely different world and do something totally different. And so at OSTP, I did a bunch of science policy work and got to hang out around and near the White House and see a change of administration as we're seeing today. Between two administrations, just a lot of stuff that as an academic chemist I would have never seen in my life. And I got a pretty up and close and personal view of it. So it was just great. And after I had finished that in September 2019, I knew I wanted to come back. And it was just a matter of where and when. And so I had looked at working at a variety of federal agencies, the National Science Foundation, and then DARPA came up. People had mentioned DARPA. I had learned about it through the DSSG, which you mentioned, the Defense Science Study Group. There are a number of prominent people at my university, UC San Diego, who are former program managers at DARPA, including our chancellor and our dean of engineering. And they had mentioned how much they enjoyed DARPA and what a special place it was. And so that really stimulated my interest. And so about a decade after I left DC, I decided to try to pursue positions in the federal government, particularly with a focus on DARPA. And ultimately it worked out. I'm here now and I really like it. I should say I'm at DARPA under a special mechanism where I'm still actually a part of the UCSD faculty and ultimately plan on returning there. And I still have a research group that conducts our research there as well, filled with grad students and postdocs.
Best of both worlds, because many program managers are so moved to come to DARPA that they'll do that even though they know it's just for a couple of years and they don't know ahead of time where they're going to end up afterwards. So it's great to have, I would imagine, the kind of security that this arrangement does afford you. So before we talk about a few of what are really amazing sounding programs that you oversee, including ones that help us take on the troubling rise of antibiotic resistance and also procuring water where it is scarce, I have to ask you about a seminar that you taught a few times at UCSD. It is called History of the American Muscle Car. Seth?
Yeah, that was a lot of fun. So UCSD has a program called Freshman Seminars. They try to incentivize faculty to get to know the incoming freshmen better in a small environment. And so it's hard in like a large freshman chemistry class to get to know your students well. And so they have this freshman seminar program that's limited to 20 students. It's just one unit. It's 1 hour a week, and you can basically teach any topic you want. So the first couple of times I did it, I tried to keep it close to home to chemistry, and I taught classes in forensic chemistry. It was called like CSI, fact and fiction. I taught a class in archaeological chemistry or archaeological sort of forensics, which I called Tomb Raider or something like that. And then I realized how much latitude the university would give me on this because they really were just interested in having faculty get to know freshmen. And so, again, inspired by my father, his brother were big motorheads when I was growing up. My dad was always buying and selling cars. So was his brother. They had worked in a gas station and owned a gas station together right near Pink's Hot Dogs in Los Angeles growing up together. I always loved cars. I'm not as knowledgeable about automobiles as my father and his brother were, but I certainly love them and know their history pretty well and have owned a few classic cars over the years. And so I just thought, hey, why not learn more about it myself and just have a fun and engaging way with the students. Much to my surprise, they approved the class. We did the class about half a series of sort of lectures, if you will, or discussions about the history of automobiles, particularly the muscle car period of the 1960s and early 70s. But then we would do the last 5 classes as a car show on one of the plazas at UC San Diego. So I would invite the Mustang Club, I would invite the Shelby Club, I'd invite the Mopar Club. And those guys loved coming out and they would show off their cars and the students would walk around. And plus a lot of students just walking by that would gawk, would walk around and talk to the owners about their cars and learn about where they came from and how they restored them and all this stuff. So it was a lot of fun.
Absolutely love it. So you're reminding me that when I was in high school, my best friend had a 65 Mustang, that he restored. That was a lot of fun to drive around in that. So this makes me wonder, what muscle car do you have in your driveway?
Yeah, so I've owned a couple over the years. I've had a couple of Mustangs because they used to be. Now they're pretty expensive. They used to be the sort of entry-level car for a collector. So I had a 73 Mach 1 Mustang, gold with a vinyl top. It was quite the thing. I had that actually back in grad school. I bought it off that uncle of mine. Then I had a 72 Mach 1. Then when I got tenure, I bought myself a 73 Mustang convertible. And then I upgraded to a 69 Firebird convertible, which that car I discovered when I was here at OSTP. My mentor at OSTP, her father owned that car. He was the original owner, had it since 1969, wanted to get rid of it to a good home. And so I took that car back with me from my first tenure in DC and restored it and drove that car for a long time. It was a wonderful car. And then my most recent acquisition that I've had just for a few years is a 63 Corvette convertible, which was always a dream. Yeah, that was always a dream car of mine. Yeah, 63 Stingray.
All right.
So
love it. Okay, so now let's get to the business at hand, which is your experience at DARPA. And so I want to start with one of your programs that, sounds like it would have been great to have the technology you're envisioning, the antiviral technology you're envisioning in it, to have that in hand now. The program's short name is Intercept. Its long name is Interfering and Co-Evolving Prevention and Therapy Program. This was started actually by a previous program manager, Jim Gimlet. I just would like you to share sort of the basic concept of the program and where it stands now.
Sure. So it's a fascinating program, and I feel privileged to have inherited it. When I joined DARPA, it was a great introduction to the agency and to get me up to speed about how to learn about a program and manage a program. And the program is focused on a class of what will be or could be novel therapeutics for treating viral disease. And these novel therapeutics are called TIPS, which stands for therapeutic interfering particle. So let's say, for example, you have the flu virus. Now we have a vaccine for the flu, but we have to reinvent that vaccine every year because the flu mutates and a new strain becomes dominant year after year. So what this approach would do that was different from a vaccine, which stimulates the immune system, or a small molecule, which is sort of your typical drug like aspirin that would just directly sort of attack the virus, is develop these TIPS. The best way I think to describe it is that it's a neutered version of the flu virus. So it has all the components of the flu virus, but some genetic element is missing or disrupted or otherwise not properly constructed. And so what you end up with is this TIP, a therapeutic interfering particle, this viral particle that looks like the virus, has many of the components of the virus, but the key part that it's missing prevents it from self-replicating. And that's really the key. And so this TIP can be given to someone. It can enter the person's cells just like a virus. But once it's in the cell, it's just stuck there and it can't do anything. However, if that same cell becomes infected by the live flu virus, the disease-causing flu virus, it turns the TIP on. And what the TIP will do is instead of allowing the virus to replicate itself inside of the cell, the TIP will steal the machinery it's missing in its neutered genome. It'll steal that machinery from the live virus and make copies of itself. And that's really important because what happens now is instead of the virus replicating itself, the TIP replicates itself. And the TIP is not disease-causing, nor can the TIP replicate once the virus is gone. So effectively, the TIP competes with the virus until the virus is just knocked out. And then the whole system shuts down and the virus is stopped. And even if it doesn't stop it on the first pass, so let's say it competes with the virus, maybe knocks down the number of viral particles that are produced, but then the virus still escapes, it can escape with it. And so if those viral particles go and infect neighboring cells, again, the TIPS can enter those cells as well and continue to combat and compete with the live virus until the live virus is just exhausted and outcompeted, and then the whole system stops.
That is an amazing kind of molecular dynamic to imagine actually, sort of pulling off. When you look at the performers, which are just say the research groups that have contracts now working under the program, how would you articulate the farthest that any of these researchers have gotten toward the goal?
Well, I'm very encouraged. It's a very mature program entering its fourth year now. And the results of the INTERCEPT program are very encouraging that TIPS could become a completely new class of therapeutic countermeasures for treating viral disease. We started, or again, Jim Gimlet before me and the other program managers that have managed the program before me started with just saying or looking at, can we make safe and effective TIPS? That is, can you make a TIP that competes with the virus, effectively knocks down an infection, and isn't harmful to cells or an animal? And what I can tell you is that for a wide range of viral diseases, from the flu to HIV to others, more exotic ones you may not have heard of, and even some more current data looking at COVID we're trying to get at. But for these established diseases like flu, HIV, and others, there is very good data showing that these researchers can develop TIPS, that the TIPS are safe in animal models, and that the TIPS effectively prevent not only an infection, but the spread of that infection between animals. And so I think the program is looking very encouraging. We are pushing some of our performers to try to get these novel medical countermeasures into a phase 1 clinical trial, and I'm hopeful before the program's over we will do that. I think that's probably the last major hurdle, is that this is an entirely new type of drug. It's not like vaccines or biologics or small molecules the way we normally think of them. And so it will be interesting to see how this moves forward in a clinical setting, how the FDA will evaluate a therapeutic like this, what they think will be appropriate. I'm very encouraged that we could see TIPS as a real medical therapeutic for dealing with viral disease in the future.
Yeah, interesting. I mean, and I'm glad that you're encouraging your performers to really think about the trials and getting the data there, because as you mentioned, this is so different from a sort of pharmaceutical mechanism and an antiviral mechanism that it could well be that the regulatory challenge is going to be the DARPA hard problem even more so than the actual sort of chemical and pharmaceutical one.
Yeah, it very well could be, because it is a really different mechanism for a drug. But if you think about the current COVID pandemic that we're all living in, I mean, if you had a drug that could keep up with that virus and not only stamp it out in an individual, but prevent that individual from spreading it to others, it's literally exactly what you would want, even more so, I would say, than a vaccine, perhaps, in the current situation we've all been living in. You know, having seen what we've all lived and experienced through the last almost coming on a year now, I think that, you know, that should provide some real incentive for tips to be given serious consideration, considering what they may offer.
May you succeed, because as we know, pandemics are sure bets. We're experiencing that right now. This new technology might not be in hand for this particular round of a pandemic, but hopefully for the next one. So let's move on to a somewhat related program in the sense that it's aiming for new kind of pharmaceutical techniques, but in this case, maybe dealing more with bacteria than viruses. It's called Harnessing Enzymatic Activity for Life-Saving Remedies, or in short form, HEALR. That's HEALR. So, and this one, too, as I said, is focused on developing new countermeasures, though more focused on sort of looking at antibiotics, which the public health community is very concerned about because of the ascent of antibiotic-resistant microbes and the potential that we could enter a sort of a post-antibiotic era where we can no longer use these fantastic medicines. So how might the HEALR program step in and save the day when it comes to fighting off bacteria?
Sure. So HEALR is a new program that my team at DARPA and I developed and got approved that we're pushing forward now. Yeah, antibiotic resistance is in many ways the sort of stealth pandemic that's been emerging for over 20 years now. So people have known that this is a problem, that the bacteria that we get infections from are becoming increasingly resistant to the antibiotics that we have available, that when a new antibiotic is developed, resistance emerges much more rapidly, sometimes within a year of the drug being first used. And so this is a crisis that has been well recognized, but like I said, many people have called it the pandemic that's been sort of evolving or emerging for 20 years. And so the HEALR program is designed to take on this challenge using a new approach, a different approach, that involves harnessing one's own biology to combat the bacterial infection. And so there's a technology that's been emerging for about a little less than a decade, I would say. And it's an approach by which a new class of drugs, often referred to as chimeric drugs, chimera referring to the mythological creature that has multiple heads on a single body, like a lion and a dragon and an eagle fused to one body. These molecules also have multiple heads, and the way they work is one head of the molecule engages your target, so something that is causing or propagating a disease. That head is attached to another head that engages some sort of biology within your cell that is designed to either deactivate or eliminate that target, to deactivate it or destroy it. And so this concept has been widely investigated and is in clinical trials currently for addressing cancer, but it has not yet been applied to many other diseases, including bacterial-caused diseases. And so what the HEALR program is largely focused on is taking this PROTACs or chimera technology and porting it from its nascent phase with cancer biology and applying it to bacterial threats and bacterial toxins, such as anthrax toxin or botulism toxin or many pathogenic microorganisms. And so this is a very, very different mechanism because you're not just sort of poisoning the organism or directly attacking a component of the organism, but you're binding part of what the organism needs to be pathogenic, and you're then shuttling it away and just using natural biological processes to damage, deactivate, or destroy those such that the disease is stopped. And this has never been applied to microbial disease before. And so we're hopeful that by bringing, again, sort of like with TIPS, an entirely new kind of medical countermeasure modality or mechanism of action, we can overcome some of the resistance issues that have plagued traditional antibiotic development for decades now.
Yeah, so the way you describe these agents, with the multiple heads and each one having a different function, absolutely, just fascinating to think of that sort of macromolecular construction. Part of it sounded like an antibody, right? Because in a sense, you do have to have a kind of specificity for one of those heads where it can go after the troublesome bacterium, but, not go after everything else. So how do you get that specificity?
Yeah, so the use of an antibody is definitely one possible approach. I'm sure when Healer begins its research efforts, it's not actually at that stage yet, but once it starts, and if you look at the scientific literature on this, what you'll see is that there actually are a variety of approaches that are being pursued, and that includes things like antibodies. It also includes small molecules. Of course, small molecule drugs can be very, very specific for a target. It includes different kinds of biological or peptide-based constructs. There are many different ways one can address this problem, actually, both to develop the head to target the pathogen, as well as the head to target the biological system to eliminate the pathogen. Both of those require development of very specific groups, and there are a variety of ways to do that. And actually, part of the Healer program is to invest in those technologies. How do you identify those, what we call ligands? How do you identify the best ligands? What are the best approaches? How do you discover them quickly and make sure, like you said, they're specific enough? So that is actually part of the investment Healer plans to make in developing this technology.
The other thing, it also sounded to me almost like in one agent, you're kind of putting together several components of our natural immune systems do, right? So like where an antibody might latch onto a pathogenic particle, it also is then flagging other cellular parts of the immune system to come in for the kill. Whereas it seems like you're getting not only your sort of selective identification of a pathogenic particle, in this case a microbe, but you're in this very same particle, you've packaged in the killing mechanism. So it seems almost like a super efficient immune system.
Yeah, actually, one of my program manager colleagues made that observation to me. He said that, it sort of seems like you're creating an artificial immune system using other biological pathways. And I think that's a very apt description. So there are certainly a lot of parallels with this chimeric approach to the native immune system. I think the potential advantage of the approach here is that you could use it to complement the natural immune system because you're not necessarily going to use the same clearance pathways. You could use these molecules to help recruit elements of the immune system to target the pathogen. But again, there are many other pathways, enzymes that would degrade the pathogen or an important component of the pathogen, or as you said, flag it for destruction, which is actually how Protax itself works. So I think, in a sense, we're almost like opening up human biology to see what other processes in human biology can actually serve as a type of immune system if we can harness them correctly.
Okay, wow. Absolutely amazing programs. Really happy to be learning about them. So, and I want to talk about one more. And this one has an acronym that sounds like it's going to be hard to live up to, but I love the acronym. The acronym is AWE. Spelled as you would expect, AWE. That stands for atmospheric water extraction. Now, the availability of fresh water is a big deal. It's becoming a bigger and bigger deal. We've had wars fought over fresh water. Changing weather patterns and droughts are making fresh water a real concern for the future in a world of climate change. So talk to me about how you imagine the AWE program unfolding and what you hope to deliver with it to the U.S. military and perhaps the civilian sector as well.
The AWE program was the first program I started at DARPA, and despite its simple acronym, it was actually one of the more difficult acronyms to come up with, not just because it was my first program, but because actually I'm a huge science fiction fan, and I was absolutely dead set on naming the program something related to Tatooine or Luke Skywalker or Uncle Owen, because Uncle Owen in Star Wars was a moisture farmer, is what they called him. So I was very dead set on doing that, but I could not come up with an acronym to fit any of those things, and so we ended up with AWE. But the AWE program seeks to take advantage of the fact, as you mentioned, water is a scarce resource. It is not only essential to our warfighters, it's essential for humanitarian purposes, and it has literally been the cause of conflict throughout the world. And so what the AWE program would like to produce is a device with a relatively low footprint in terms of energy and size and weight that can harvest the naturally occurring moisture that we have in the air all around us, right? So especially living here in the Washington, D.C. area, especially in the summer, many of us will complain about how humid it is. And that humidity, of course, is a measurement of how much gaseous water there is in the air. It's a very pure form of water, and it's just sort of sitting there ready for the taking. The challenge is how do you get that water out of the air in an energy efficient manner with a small footprint device? So we have ways of capturing water from air, ranging from very low energy devices, but that require a very large amount of space, such as things called fog nets. Fog nets are used under humanitarian situations. They act almost like a big leaf, and they capture water condensing out of the air. But they're huge installations. They're not very practical for the Department of Defense. And you can only use them where you have 100% relative humidity, so where you're literally, the water's just dripping out of the air. And so that's not always useful. We have other devices like condensers or dehumidifiers that can cool the air such that you can then get the water to liquefy out of the air, condense out of the air. You can think of this as your home air conditioning unit. If you've ever run sort of like a window unit, you'll see the water dripping off of the condenser. In that case, it's being used to cool the air, but you can run that device, your air conditioner, in a similar way to collect water. But the issue there is that, as we all know in the summer, especially in a place like the Washington, D.C. area, our electric bills go up tremendously when summer hits because the air conditioning is a very energy intensive process. So that cooling of the air takes a lot of energy and makes that kind of water capture likely not useful for the Department of Defense and not useful for a lot of other, say, humanitarian applications. It's just too energy intensive. In the AWE program, we hope to find that happy medium of a device that can capture that water from the air under a wide range of environmental conditions, from very humid conditions to very dry conditions, with a small size, weight, and power input. And the key to this is two parts. First is the development of new sorbent materials. So new materials that can extract the water from the air efficiently. And many of us are actually familiar with these sorbent materials, but we need a next generation one. So the everyday familiar example of a sorbent is the little silica packet that you might get with a new pair of shoes or a new backpack or piece of clothing. That little silica packet is designed to absorb water from the air to keep the clothing fresh and not being damaged by the humidity. So that material very effectively actually grabs the water from the air. The challenge with something like silica is that it doesn't let the water go very easily. It takes a lot of energy to get the water back out of that material. And so what we're looking at in AWE is to develop very sophisticated modern materials, next generation materials, that can not only absorb the water, but then release it under relatively mild conditions such that we can make a device to harvest the water. So that's the first part of the AWE device.
And just a question there. I mean, how might you trigger the release then? Would that be, from sort of electrical stimulation, magnetic? I mean, how would the materials actually be stimulated to release it?
There's a number of different possibilities there. Our performers that have just started their work are looking at different options, but it could range from all of the above that you just mentioned and others as well. So you can heat materials, you can potentially do some of the things you mentioned, you can use a variety of sort of thermal or electrical or other stimuli to try to get the water back out. The key is to make sure that the energy required is as low as possible. Right,
and you were about to go into this sort of the second big element of the program.
Right. So the second big element is the engineering. So we do have some new sorbent materials that have been described in the scientific literature that look very promising for this application. And they have really spectacular water absorption and release properties that we can build off of. But nobody has ever really holistically designed a device to fully exploit these new water harvesting materials. And so the second part of the AWE program involves very advanced engineering and modeling to create a prototype device that maximally exploits these sorbent materials. And the program is divided into two what we call tracks, One is called the expeditionary, and the other is called the stabilization. And the expeditionary track is designed to create a device that an individual would carry and would be very small, obviously, in size, maybe something the size of a canteen, that would harvest water from the air and then fill up that, for example, warfighter's canteen or their camelback or whatever receptacle they have for collecting the water. So this would be a small device just designed to provide enough water for an individual on a daily basis. And then we have a stabilization approach where this would be a larger device, maybe something on the size of a refrigerator, but this will produce a much larger amount of water and could supply potable drinking water for, say, a company of individuals, say 100 or 150 individuals. These require very different engineering challenges or present very different engineering challenges. And so our performers have to take that under consideration as well, both from the material standpoint and the engineering standpoint, depending on which device they're trying to successfully produce. Both an expeditionary and a stabilization size device could have a number of both commercial and humanitarian applications.
We're going to come into for a landing here. You've been very generous with your time. Just a couple of quick questions. Maybe we can be brief here. One of them is just sort of trying to have you think about your experience in academia for 20 years and now as a program manager in a federal R&D agency, which is to say DARPA. And how would you compare and contrast the role of academia and an agency like DARPA in the overall innovation ecosystem?
I think they play very different roles in many respects. First of all, I'll say I like both work environments very, very much. And I have to really say that DARPA has been, as many people told me it would be, one of the best places I could ever imagine working. It is a fascinating agency filled with incredibly smart, motivated people who create an incredibly supportive work environment. So I'm very pleased and honored to have been part of DARPA and to continue to be part of DARPA. I would say that, the role in terms of scientific innovation and the ecosystem, the universities are really sort of the front line, right? So maybe in Department of Defense terms, they're sort of the tip of the spear, right? They're the ones in the labs doing the research, with grad students and postdocs and undergrads and faculty and research staff out there, pushing the boundaries, making the discoveries, and innovating, of course, and coming up with lots of creative ideas constantly. I think that the role of DARPA, as well as other federal agencies that don't have their own research component, like the National Science Foundation, where like DARPA, they're just funding research, not performing research themselves, they are a critical part of that infrastructure because that tip of the spear in the laboratories around universities can't happen without federal support and federal funding. And so a place like DARPA not only provides the financial support to allow the research to function and to proceed, but DARPA, I think, also plays, as well as other agencies do, a very important point in pushing those boundaries, right? So one thing, having been on both sides of the fence here, the academic research side and the DARPA side, one thing that DARPA is very well known for is really pushing the boundaries, right? As an academic who's historically, sought federal funding from a variety of agencies, very often you can tend to be a little bit more conservative when you're asking for federal support because you want to make sure that your program's going to work and that the reviewers of your grant believe it's going to work and that you can show that you've done research along those lines that shows that you're really capable of doing it. And that tends to keep our ambitions in academia sometimes a little bit tempered because we have to make sure that we can convince the federal government and these agencies that we can continue to do that work. And that's a very important function. I'm not knocking it in any way, but there can be a tendency for that. And people, I think, on both sides of the aisle or both sides of the fence know that. And so DARPA plays this very special role because it is known for being a cutting edge agency. It's known for pushing the boundaries. And though our performers are highly qualified and highly skilled individuals, and teams of individuals rather, they don't necessarily have to have shown that they can do this yet. It's the latest and greatest and in many ways can be the most riskiest research. And that's an important role I think that DARPA fulfills, is pushing that very cutting edge, allowing people to take chances, to try crazy ideas that are still grounded in good science and good concepts, but that might be outside the comfort zone of a lot of other parts of the federal government to fund. And I think that's why you see, and this has been spoken about for many administrations now, other federal agencies trying to emulate DARPA. And I think that's a good thing. I don't think they should try to emulate DARPA to the point of their own non-existence. I think, funding agencies like the NIH and the NSF and the DOE and NIST, on and on and on, they play very important roles in the type of research they fund and the way they do it. And they have their own missions that are extremely important. But many of them have taken a nugget of DARPA's sort of theme and tried to incorporate it into their own portfolios. And that I do think is a good thing. Probably the most notable example is ARPA-E over at the Department of Energy, where they're trying to push cutting edge technology for energy sciences and those applications. So yeah, I think universities are sort of the tip of the spear. Certainly idea generating as well. And then DARPA plays that sort of super supportive role and allowing and encouraging those tip of the spear researchers to push those boundaries.
Thanks for giving listeners a sense of the many parts of the innovation ecosystem, where academia fits in, where DARPA fits in, and of course other components of the whole research infrastructure. So that was really great. So just before we do close here, Seth, I wanted to just give you an opportunity to bring up anything that just didn't come up in a discussion and didn't come up out of a question I asked, but that you think might be interesting for listeners to know.
I guess coming from academia gives me a different perspective on DARPA and federal service. Certainly, I'm not the only one to have done this. There's many people before me. But I do think it gives me a perspective that I'd like to share, and I would share it twofold. One is DARPA and federal service in general, I think, is a very important and very valuable thing that academic scientists and scientists from industry, from the private sector, should consider. We are very, very lucky to live in a country that so highly values science and innovation, engineering. And it's valuable and I think important to take time out of one's own career to be part of that ecosystem on this side and understand how it works and to try to make it better. The other thing I'd like to highlight is for all those graduate students and postdocs out there. So at DARPA, just like at my university job, I am given a small team of PhD level scientists to help support all of these programs that you talked about, Intercept and Healer and AWE. And they help go through all the technical data and help manage the programs. And they've even helped inspired many components of these programs. And it's a career opportunity that I think many postdocs and graduate students across the country are probably not aware of. And it is a very, very exciting and I think enriching career path to consider. And so that's the other sort of takeaway I'd like to put out there into the ether for the grad students and the postdocs that are looking at, what their next step is.
Great. This was just a really, really fun conversation for me. We covered a lot, some amazing things. One program that could bring us new antiviral technologies, another one that could potentially play a role in this enormous global concern that antibiotics are becoming less effective and we're going to really need new ways of countering bacterial infections. A program on yanking water out of the air, both for military and civilian uses, perhaps down the line. You've talked about the innovation ecosystem, and you did a great recruiting talk at the end here about why one should work for a place like DARPA. So I just want to thank you for all of your time, all of your thinking, your expertise. Thanks for joining me in this Voices from DARPA conversation.
It's been my pleasure, Ivan. Thanks for having me.
And thanks, listeners, for sharing this time with us. I hope you join us again for the next Voices from DARPA. Thanks also to Ben Sullivan for his partnership in producing this program. For more information about Dr. Seth Cohen, the programs he runs in the agency's Biological Technologies Office, and the other breakthrough technologies DARPA is working on, visit darpa.mil. And for links that enable you to download this podcast, go to the Voices from DARPA page on DARPA's website.